My name is Huda Hajinoor and I'm a nurse. I've been a nurse now for 18 years, and during COVID I realised that there's a huge need of support within the community that I come from. There was many people that were aware of COVID and didn't know what to do, what support was needed for them. And through finding out the needs and the way people saw COVID, made me set up a CIC organisation to support marginalised community, along with a colleague of mine called Asha. Together we worked through COVID, and then we find out that there's a huge need in terms of addressing health inequality, galvanising the community. There's huge mistrust on services. There's also huge unhealth illiteracy in some communities. And from there on we set up Afi Health.
Yes, wow, the St. Paul's Community Clinic. That's AFTI Health. Yeah, it's a brilliant project, excellent project. We need more of that. That project needs to be in Easton, it needs to be in Fish Ponds, it needs to be in Southmead, it needs to be in Lawrence Hill. Anywhere where we are, people, it needs to be.
I've lived in Bristol for about 5 years, and I first came acquainted with St. Paul's almost immediately when I moved here. There have been times when it has been really challenging to access the healthcare that I needed. Last year, specifically, to get access to a GP, I had to go to so many different places. Without exaggerating, maybe I spent a month and a half making dozens of phone calls, visiting 5 or 6 different places within Bristol. It took a very long time to actually get the appointment I needed.
I hadn't been to the doctors in 15 years or more, so I didn't feel like I needed the doctor because I ride everywhere, walk everywhere, I feel healthy. But when I had my blood pressure taken, something came up that I really realized that I need to change my lifestyle. So I've read literature, I listen on the radio, I get advice like that, but I just don't mind in it. Just feel like, nah, I don't need you to test me like that. I feel so much more healthier because of your advice at the clinic.
When people come to our clinics, we often go through various different questions. We check their blood pressure, their height, their weight, their BMI. And we also do some educational aspects with them as well. So we talk about things like cancer screening, cancer awareness, high BMIs, losing weight, exercising, all of the preventative measures. And then what we do is we go through the picture frame there, and we talk to women about how to examine their breast, what to look out for, the importance of having their mammogram done when it's sent to them, symptom recognition, the fast track 2 weeks to see the secondary care if they see symptoms of cancer and how they can articulate it to their GPs, etc. So there's a lot of we do it in the person's first language so that they can have a clear understanding.
Definitely yes. Yeah, definitely yes, because that gives me a chance to talk to lots of people from different backgrounds where that I'm targeting. I'm targeting people with Asian, Afro-Caribbean, African, and Somali. It's really diverse here, and that we meet every other week in different areas of Bristol. Before that, I have to work really hard to organize events to bring all those people to one point or one place. Having a partnership with Afi Health, that's really helped me. And usually in each clinic, either if I did not convince to register 2 or 3, then at least the knowledge is there. At least I help people from our community to understand the need of blood and organ donation.
I think it's really useful because it's just really convenient and it's really quick, and it's just nice to come down and just have rather than making an appointment with your doctor, just coming down here for 10 minutes to get something checked out that you were thinking about. I hope more people hear about it because it's just really convenient just to come down and just get the checks and just talk to people about your health and stuff if you need anything more. But it was just really useful for me to get my blood pressure checked and just BMI checked, just for ease of mind.
AFI is a great place and it's easy to access with the community. And we are very happy to have someone like Huda and her team, and just to have a health advice. Sometimes you couldn't find it with the health advice. If you want to go to your GP, it takes longer, or you can't get that appointment, and it's easy to access, and it's very good for the community. The people, they don't have access, and they don't have an idea what is about the cancer and how to cure, how to prevent the cancer, or just to cure or get advice. And it's very sad in the community. For example, so many communities, there are a lot of suffering at the moment.
My name is Abdurrahman Mira. AFI is helping me a lot because I didn't know I'm diabetic. When they tested me, they found me I'm diabetic. My first test was 16, something like that. Then after that, they transferred me to my GP, and then my GP helped me. And I took my medicine, then I'm good now. Before that, I used to smoke in October. I stopped smoking in October because AFI, because when I come AFI Health, they advised me to stop smoking as well. That's gonna make worse for diabetic. After that, yeah, it's helpful. I didn't smoke for 6 months at the moment. Yes, absolutely. They help me, and they help for a lot of people with their own language as a Somali community as well. Yeah, we got the opportunity as well.
We support them with barriers that they face, such as digital exclusion, but also language barrier, mistrust, and many other forms of barrier that come in. And we galvanise the community into supporting each other and into being aware of their own health and building someone's health literacy so they're more confident and they're more empowered to look after themselves. So we advocate for things like cancer screening, preventative measures, blood pressure, but also just talking to someone about and supporting them. So advocacy if someone's diagnosed with something that they don't understand, and offering that support services and that language support as well.